Okay, we are group 7, and this is our intervention presentation. We chose Nora for our client. She is 5 years, 2 months old. A little bit about her background. She is currently in kindergarten. She was diagnosed with autism, and she is described as nonverbal, but does use pictures and some signs for communication. Nora lives with her mother, father, and 2 older siblings. She has no history of significant illness, and mother reports no complications during birth or pregnancy. Nora has reached all other developmental milestones aside from her language and speech. Nora has passed her most recent hearing and vision screenings, and an oral mechanism exam shows no signs of restrictions that would lead her to be nonverbal. She began attending preschool at age 4, where she received her autism diagnosis, and she currently attends kindergarten and is showing some interest in communicating through pictures and signs. Some assessments. We did the expressive vocabulary test, which can be modified for nonverbal children. Her results showed that she is 2 standard deviations below the mean, which means she's significantly delayed and performing lower than 98% of her peers. She may have difficulty expressing her ideas, emotions, and needs. The Peabody Picture Vocabulary Test, also modified for nonverbal children, showed that she is 1.47 standard deviations below the mean, and it's kind of within the borderline range. She definitely has difficulty understanding spoken language. Her vocabulary is below average, suggesting that she may have difficulty understanding spoken language. A dynamic assessment showed that she is stimulable to use AAC to communicate her basic wants and needs. Our analysis shows that Nora scored significantly below same-aged peers in expressive. She was in the 2nd percentile, and receptive, the 16th percentile, standard communication evaluations. This indicates she may have difficulties expressing her wants, needs, and ideas in the classroom as well as in the home. This might lead to frustration and communication breakdowns with family members and peers. Test results show she has difficulties understanding spoken language, which would affect her ability to develop language at the same rate as same-aged peers. And in the classroom, this would lead to difficulties developing relationships with peers, engaging in social activities, and following directions.
For our first long-term goal, by May 1st, 2025, during structured reading activities, Nora will answer comprehensive questions about a presented story, given no more than 2 verbal or gestural cues with 80% accuracy across 3 consecutive trials as measured by clinician data and observation. For our first short-term goal, in 6 weeks, when presented with a picture card depicting different scenes, Nora will be able to show which emotion is being depicted, given no more than 2 visual or verbal cues with 70% accuracy across 3 consecutive trials as measured by clinician data and observation. Our rationale for this short-term goal is that the identification of emotions depicted will encourage Nora to use expressive language skills as well as pragmatic skills, such as the way individuals use the emotions themselves. The comprehension of these emotions will also promote the use of the receptive language skills, which Nora has scored significantly lower in assessments in comparison to same-age peers. In our second short-term goal, in 6 weeks, when asked to locate a certain person or object in a picture, Nora will be able to find and point out where the item is given no more than 2 visual or verbal cues with 70% accuracy across 3 consecutive trials as measured by clinician data and observation. Our rationale for this goal is that the identification of a person or object in a picture will encourage Nora's comprehension of what is being asked of her to locate. In turn, it will promote her receptive language skills, encourage her listening and understanding of language concepts such as prepositions or descriptors. In our third short-term goal, in 6 weeks, when presented with a story, Nora will also answer a contextually appropriate where questions about the story given, no more than 2 visual or verbal cues, with 75% accuracy across 3 consecutive trials as measured by clinician data and observation. This goal would promote receptive and expressive language skills and would allow for comprehension of more complex sentences and identification of important details within the story. Understanding context would also be encouraged, especially the distinction of characters, emotions, and the themes. For our second long-term goal, by May 1st, 2025, during a structured play activity given no more than 2 visual or verbal prompts, Nora will use a multimodal approach to increase the use of more than 2 word phrases using a variety of word types, such as descriptors, nouns, prepositions, in 3 out of 4 opportunities across 3 consecutive trials as measured by clinician data and observation. For the short-term goal, it is in 6 weeks during structured play activities given no more than 2 visual or verbal prompts. Nora will use more than 2 words, including attributes, to describe objects in 4 out of 5 opportunities across 3 consecutive trials as measured by clinician data and observation. For this goal, I would promote the use of expressive language to describe objects Nora is exposed to in everyday life for generalization. For our second short-term goal, in 6 weeks during structured play activities given no more than 2 verbal or visual prompts, Nora will use more than 2 word phrases, including locatives, to engage in conversation about her play actions in 4 out of 5 opportunities across 3 consecutive trials as measured by SLP data and observation. The rationale for this goal, we are trying to promote the use of expressive language and use of age-appropriate prepositions. This is to encourage more complex language types to be used and give more opportunity for Nora to explore descriptive language. In this third short-term goal, in 6 weeks during structured play activities, given no more than 2 visual and verbal cues, verbal prompts, Nora will use contextually appropriate more than 2 word age and action phrases to describe or play actions in 4 out of 5 opportunities. This goal would promote the use of expressive language and age-appropriate syntax, and would also increase the use of semantics based off her actions during structured play activity to demonstrate understanding of context. For our data collection, baseline data was collected during the dynamic assessment. So future data would be collected using a data collection sheet, which will have columns for correct or incorrect answers, as well as the modality she used to answer. This would be verbal, gestural, or with the use of the AAC machine. A separate column would be included for the required level of support needed during each session. And we included a little chart here for when being asked which emotion is being displayed in an image. As far as our theoretical framework, we chose the behavioral theory because it best suits our client's needs. It focuses on language acquisition based on modeling, and because our client is nonverbal, it is a way for us to show her how to better her expressive and receptive language rather than just telling her. This theory also allows the SLP to meet Nora at her level of communication. Modeling, imitation, and positive reinforcement are the main strategies we use in our short-term goals and intervention strategies. And using the AAC is a skill that needs to be taught, and it's generally taught using modeling or imitation.
So our lesson plan development, the materials that we will need as a book about a preferred topic, a PEX or AAC device programmed with relevant images for each book, a data collection sheet, a token board for reinforcement, toys relevant to the selected books, i.e. a farm animal, unicorns, princesses. The design for our lesson plan is that the session will begin by asking Nora to pick a token for her board so that she can work for it. As we read the story, she will ask her WH questions about the story. For example, who is the farmer talking to, or what is the princess wearing? For each response, a tally will be added to the data sheet indicating whether it was a correct or incorrect and which modality she used to answer. Each time she engages with an appropriate response, she'll earn a token. After the story, we will engage in direct play while asking WH questions about her actions. For example, what is the princess riding? Who is the cow talking to? Our intervention strategies involve modeling. We will use modeling when using the AAC device for Nora. We do not believe she needs hand over hand, just a visual cue. We will also use reinforcement. We use positive reinforcement to reward her appropriate behaviors. And lastly, imitations. We will use imitations with Nora when she's learning to use her AAC device and also when we are cueing her during a session. Our SOAP note. So, for starters, Nora was ready to have fun as soon as she got to the therapy room. She seemed happy. It showed me her special treat that her mom left for her in her lunchbox. She was excited to show me this because she had just come back from lunch. Our observables, Nora was was ready. Read a story about a farm animal. Nora was given a token to move along the token board, and these were used when she was engaged in appropriate responses after being asked WH questions about the farm animal book. She accurately answered 3 out of 5 WH questions about the book. The target was receptive language. For assessment, Nora performed well in her test. She is progressing towards her goal of answering comprehensive questions about the story. She answered the questions today with 60% or 3 out of 5 accuracy, which is an improvement from last week's session where she only answered about 40% of the questions accurately. For the plan, continue treatment and monitor progress to improve expressive language. And these are our references. Yeah, stop.